I am Dr. Sahakian. I'm the Chief Medical Officer at Pacific Fertility Center in Los Angeles. In this next video segment, I'm going to talk about the human reproductive system, starting with the male and then the female. So let's start with the male reproductive system and understand what is needed to have a baby. So clearly we need the sperm. The sperm is a very small cell with a head and a tail. And the reason why this is so important to understand, because any anomalies in the head or the tail can affect fertility. So the head is where the DNA material is present. And when you have an egg and a sperm unite, the DNA materials between the egg and the sperm unite to become an embryo. So when you look at the sperm, you're evaluating several variables. You're looking at the number of sperm present in a sample. That's one of the most important variables we check for. And typically we're looking at 15 to 20 million sperm per each ml or cc of semen. That's considered normal. So anything lower than 15 million will be considered as an abnormal variable, abnormal parameter. Then we look at something called motility. Motility is basically the sperm moving. So the sperm cell is a moving cell. It's active. It's how it reaches the egg once deposited in the vagina. And this movement is critical in achieving fertilization. So when we evaluate the sperm in a test called the semen analysis, we're looking at the motility, and we want the motility to be higher than 40 to 50%, which means more than half of the sperm should be moving in a forward progression. And finally, there's a third parameter that we look at, and that's called morphology. Morphology is the shape of the sperm head and the shape of the sperm tail. Any abnormality in the head or the tail can affect fertilization and outcome. For instance, sperm has a head that's supposed to be oval. So if the sperm head looks like this, that's abnormal. It will have a hard time fertilizing an egg. Or if the sperm has a short tail or two tails or a split tail, all of these can affect outcome. So when we're looking at the sperm, we look at the number, the motility, and morphology. And typically we want somewhere around 4 to 5% of the sperm that's produced to be normal in shape of the head and of the tail. So these are the three parameters that we look for when we're evaluating the sperm. The sperm is made in the testicles. Now the testicles clearly are outside the body, and the reason for it, because sperm is very sensitive to temperature. And the testicles being outside the body, the temperature is actually lower. Hence why we recommend men to avoid saunas, jacuzzis, hot tubs, because the heat can affect the sperm. So when you're looking at the male reproductive system, we realize that men can make sperm until death. The sperm cycle is about 70 to 80 days. So you have the testicles. They are basically these factories in the testicles that make sperm continuously, non-stop. And there are thousands and thousands of these factories that work not at the same time, at different times. So there's always sperm production. And the sperm is then produced and released into part of this tube that then goes out when men ejaculate. So this is how sperm is produced in factories in the testicles continuously in a cycle of 70 to 80 days, which means each factory will generate new sperm every 70, 72 days and perpetually until death. Now, sperm quality will decline with time, but unlike women where you stop making eggs at menopause, we men continue making sperm forever. Hence why, theoretically, men can have kids till death. So that's basically is the male reproductive system. So let's move on now to the female reproductive system. We talked about the sperm, so we need to talk about the egg. So when we look at the egg, and if you take a sharp, sharp pencil and you make a finest dot possible on a paper, that's how big an egg is, which is, by the way, 400 times bigger than sperm. So the eggs are in the ovaries. A woman has 2 ovaries, and all of the eggs are in these ovaries even before birth. So unlike men who make sperm in cycles perpetually every 72 days, women are born with their eggs, with their complement of eggs. And all you're doing now is using these eggs from birth all the way to menopause. In the first 10, 12, 13 years of your life, of a woman's life, the eggs are just stored in the ovaries and they're never released. But after puberty, a woman starts ovulating, and every month an egg is released. But they are born with 1 million eggs, and by the time you reach puberty, you've lost half of your eggs. So a woman is born with 1 million eggs and loses half of those eggs by the time she reaches puberty at 11 or 12. And then from puberty to menopause, which is about 400 ovulatory cycles, those 500,000 eggs are used by ovulation every month. So we're wasting eggs every month more than we need, because we ovulate 1 egg a month, but we have 500,000, and yet we run out of eggs at 50. Unlike men, where we never run out of making sperm. So what happens in a natural cycle, in an ovulation cycle in women? So I'm going to draw an ovary so you can see what happens at the beginning of the cycle. So the first day of the cycle, when your period starts, you have these little follicles. They are called antral follicles that start growing. Beginning of each cycle, whether you ovulate or you don't, every month the same thing happens. Dozens and dozens of these eggs start growing. One of them, so this is, let's say, day 1 of your cycle. As these follicles grow, here we go, this is day 4, let's say, and I'm making a little kind of a circle what happens so you understand. One of these follicles becomes dominant, and it secretes chemicals that kill everybody else. And it's this dominant follicle that will release the egg every month. So what happens in a natural cycle is that at the beginning of the cycle, dozens and dozens of eggs start growing. One of them becomes dominant, and that's the egg that's released. Every other egg dies. So it's a kind of a process where eggs are wasted every month. So what happens in a woman's life cycle is that every month you're losing eggs until you reach menopause, when you run out of eggs. In addition to that, because you were born with a complement of eggs, all of your eggs have been there since before birth. With time, not only you're losing eggs and you're depleting your reserve, but the quality of the eggs also is deteriorating. So if we take a 20-year-old, for instance, at the age of 20, let's say 7 or 8 of 10 eggs are genetically normal and capable of becoming a baby. But at the age of 40, 1 of 10 eggs is genetically normal and has the ability to become a baby. And when you reach at 43, that number drops to 1 in 15. And pretty much at the age of 44, you're down now to 1 in 200, 1 in 1,000 chance that you're going to produce a normal egg. So it's almost impossible to produce a normal egg after the age of 44, 45, unfortunately. So the reproductive health span of a woman really goes from puberty to about the age of 43. After that, not only you've lost most of your eggs, you've also lost the ability of producing normal eggs because the eggs are getting older. That's the bad news. One of the good news is that a normal egg at 43 is as normal as a normal egg at 18. It's just you have less of them. That's why it's harder to get pregnant as you get older, because not only you're losing eggs, you're losing good eggs or normal eggs that are incapable of becoming babies. In this next segment, I'm going to talk about common causes of infertility. And it's not as complicated as it sounds, actually. So in order for you to become pregnant or to have a baby, we need a healthy egg, we need a healthy sperm. Egg and sperm have to meet. They meet in the fallopian tube, so we need healthy tubes. And once the egg and sperm meet in the tube, the embryo travels back to the uterus where it implants, so we need a healthy uterus. So in order to successfully conceive and have a baby, we need to have all of these four. Not one, not two, all four. We need healthy eggs, healthy sperm, healthy open tubes, and a healthy uterus. So how does this fertilization process work inside the body? So this is the uterus. And this is the uterine cavity. Here we go. Okay. So this is the vagina right here. This part is the cervix. So sperm is deposited in the vagina. It will travel up through the uterus, and the sperm will go inside the tubes. And here's an ovary, here is an egg. The egg is released mid-cycle during ovulation, and the egg waits for the sperm inside the tube. So the sperm travels from the vagina through the cervix, through the uterus, inside the tube, and meets the egg right here. This is where fertilization happens, and you get a little embryo that starts dividing and travels back, and it implants inside the uterus. This is the human reproductive cycle. Very, very straightforward. So in order for you to get pregnant, you need normal sperm deposits into the vagina. You need to ovulate, and the egg has to be picked up by healthy tubes. So the tubes have to be open and healthy. Sperm has to reach the egg, fertilize the egg, and then the embryo has to travel back to the uterus and implant in a healthy environment, a healthy uterus. So a lot of things have to happen normally for you to be pregnant. You wonder how anybody gets pregnant with all this complicated process, but we do. So anything that goes wrong in this picture or in this process will affect fertility. So number one, eggs. So let's talk about the common causes of infertility. And I'm going to start actually with the sperm. So if the sperm is bad, count is low, motility is low, or the shape of the sperm is abnormal, that's going to cause infertility. Easy to test. We do a test called a semen analysis. Abstain from ejaculation for 2 to 3 days, give a sperm sample, we check for these 3 parameters, come up with the result, and we have an answer very quickly. Let's go to the next common cause of infertility in women. Let's talk about the eggs, okay? 2 things need to happen with the eggs. 1, production, which means ovulation, right? In order for you to get pregnant, you need to produce an egg and you need to release the egg. Any woman who has regular cycles every month, 25 to 32 days, is ovulating. We don't need to do any tests. History is more than enough to document ovulation. And if you feel like your period is coming, or you feel like you want to kill someone around that time, you're ovulating. So ovulation is necessary for you to get pregnant. That's the release of the egg, number 1. So if you have irregular periods, like women with polycystic ovarian disease, and your periods are every 60 days, 90 days, you're not ovulating. And if you don't ovulate, you're not going to get pregnant. Doesn't matter how good the sperm is. But ovulation is not enough. We need also quality. This is where age comes into the picture. So just because you're ovulating at 46 doesn't mean you're able to have a child. Because if that egg that you're producing is genetically abnormal, you're not going to get pregnant. So That's why we stress age as a main factor in fertility. We say, if you're getting older, try and get pregnant as soon as possible, simply because as you get older, not only you're going to run out of eggs, but you're going to run out of good eggs. Hence why age is so critical in success. So that's when we look at infertility as a doctor, we check the sperm, and then we look at the eggs. And how do we check eggs? History will tell us if the woman is ovulating, and we do 2 tests to check for ovarian function. One is called an AMH. That's an anti-Mullerian hormone blood test, and it tells us how good the ovaries are, because there are variations. At 28, the ovaries are not as good as 36, but sometimes even at 28, you lose ovarian function. And AMH will tell us how good the ovaries are. But the ultimate test is a test called AFC, or antral follicle count. And that's a simple ultrasound, a vaginal ultrasound, where we look at the ovaries, best done in the first week of the cycle, and we count these little follicles that I referred to earlier called antral follicles, and we come up with a number. And that number correlates with pregnancy rates. Typically, you want an AMH of more than 1. The closer to 1, the lower than 1, then it's worse. It means you're not producing enough eggs. And typically, the follicle count, you want somewhere more than 8 to 10. The more follicles you have, the more eggs you have, the better your ovarian reserve. Kind of similar to sperm. If I have 60 million sperm, it's better than having 20. But with eggs, it's even more important. The more eggs you have, it shows good ovarian function. However, if you're 40 and you have 20 eggs, those 20 eggs are not going to be as good as 20 eggs from a 20-year-old, because in those 20 eggs at the age of 40, you're lucky if you have 2 normal embryos, versus at 20, probably more than half are genetically normal. So the common causes of infertility, as we just discussed 2 of them, and just to review quickly, 1 was sperm, 2 was eggs. Again, you need normal sperm, you need to ovulate, and you need to have good quality eggs. They have to meet, and that means you have to have open fallopian tubes. The test to check for this is something called HSG, where we shoot dye through the cervix and see if the tubes are open. You can only have tubal disease if you've had pelvic surgery or you had a sexually transmitted disease. So if you have no history of having an STD or pelvic surgery for an ovarian cyst or fibroid, most likely your tubes are open, and we don't do this test. It's useless. This test is helpful if there is suspicion of tubal disease. Finally, you need to have a normal uterus. And I always say the uterus is like the soil. Sperm and egg unite to make an embryo, which is the seedling, and you need to have a normal soil where the seed grows, and that's the uterus. So you need to have a healthy uterus with a good lining, and you check for that with a simple ultrasound. And we can tell if the uterus looks normal, if there are any fibroids or polyps that can affect fertility. So this is kind of, in summary, the common causes of infertility: sperm factor, egg factor, tubal factor, and uterine factor. Now, is this all? No. There are other reasons why women can't get pregnant, including immunologic, which means your body is making antibodies that attack the egg or the sperm or the embryo. There's a condition called endometriosis. I'm not going to go into that very deeply, obviously, but that's a disease that affects women that can cause infertility by causing scarring, by causing immunologic infertility. And there's a group of women where we say it's unexplained, which means we really can't explain. That's not necessarily good news, but there is a subset of couples where we have no answers. We still can treat you, we can still do IVF and get good success rates, but we don't have the answers in every case. These videos are educational, but if you want to learn more about the process, please call our office and make an appointment to see us.